Hi, welcome to this edition of McKnight's Live. We're interviewing thought leaders about important issues in senior living and care. I'm Lois Bowers, editor of McKnight's Senior Living, and I'm here today with LeadingAge at the LeadingAge annual meeting, speaking with Mollie Gurian, Vice President of Policy and Government Affairs at LeadingAge. Mollie, thanks for being here today.
Thanks for having me, Lois.
Part of your expertise is expertise in home and community-based services, and HCBS providers include not only home care agencies, but also organizations such as assisted living communities. And since I'm the editor of McKnight's Senior Living, I wondered if we could talk about assisted living for a minute. And I wondered, how do you view assisted living's role in the aging services ecosystem? And what do you think the biggest issues are facing assisted living communities today?
Assisted living is a really vital part of the aging services continuum. When we talk about home and community-based services, one thing that LeadingAge has been pointing out over the years is that there's a lot of focus on care at home, and care at home is super important, but care in community is equally important and gets a lot less attention. So our assisted living members are part of that care and part of that essential care in the community, part of that continuum. And as people age and have more needs, the ability to elect an option like assisted living is really critical as they're making their aging journey. Because there are a lot of people who need some assistance with things like activities of daily living, but don't yet need a nursing home level of care. So the ability to move into an assisted living community helps them to maintain some independence, but also get the assistance that they need. And others might want to get that assistance in an assisted living community rather than at home to combat things like social isolation and other needs for socialization and community. So assisted living is a critical part of our continuum. What are some challenges facing assisted living operators? I think that you're going to hear a theme throughout our conversation today and throughout conversations here at LeadingAge. Workforce is a big part of assisted living operators' challenges. There just simply aren't enough people to meet the needs, and assisted living really varies between states as to what kind of professionals are most important for maintaining an adequate workforce in those communities. So some communities it's going to be the need for registered nurses, and others it's going to be aides, dining, but generally speaking, workforce is going to be a top concern. And then state level regulation varies state to state how assisted living is regulated, but we're seeing different types of regulations pop up across our state partners, and always a concern for our assisted living members.
So assisted living, of course, as you alluded to, is primarily regulated at the state level, but about 18% of assisted living residents rely on Medicaid to pay for daily services, and about 61% of assisted living communities are Medicaid certified. Do you think the federal government has played an appropriate role in assisted living, or is more or something different needed?
Yeah, so on the Medicaid side, you get a federal state match, but a lot of our advocacy and continued advocacy will be on the state level. Will be among our state partners on the state level for increased reimbursement for assisted living, so that more members can take Medicaid and serve those lower income folks who need assisted living, because the need for assisted living doesn't change based on your income. There are a lot of people who need it who can't afford it private pay, so it'd be great to have more Medicaid access, and that's and advocating for those rates is really something that our state partners are very good about and is really important to them. In terms of the federal role, we think that state and local regulation of assisted living is appropriate. Those regulations have really evolved to meet the needs of various communities. And the regulatory structure is already quite intensive across many states. So in that way, the federal government's role has been appropriate. I think where they could do more is, once again, like big investments in workforce. Like, could there be training, investments in training specifically around like dementia care that are national and universal skills that you would need in assisted living as well as in our other care settings. There could be a lot more investment in those kinds of training opportunities. Also in maybe making like a clearinghouse so that people understand what assisted living is in various parts of the country and know what to look for and what they're looking for in assisted living, like what kind of questions to ask. Because even though they are regulated differently in each state, it would be good for consumers to have more of a sense of what the services are, and it would be great to have that at the federal level as a way to sort of navigate through.
Mm-hmm. It's tricky since it is different from state to state.
Yeah.
Let's switch gears a little bit and talk about hospice. Hospice and hospice reform have been top of mind this year, especially for people, including readers of McKnight's Home Care. Where are things with that effort, and what do you see as the next steps?
Yeah, so looking back over the past couple of years, hospice reform has been top of mind. Unfortunately, the impetus for that was a lot of fraud in the Western United States and the uncovery of really bad actors in the hospice space, people enrolling people who are not appropriate, and then people not being able to get off of hospice who are not actually dying and are in need of other Medicare services, because when you elect the hospice benefit, you're giving up access to most of your other Medicare coverage. So, being enrolled inappropriate can have a real detrimental effect on your care. As well as, the discovery of like hundreds of hospice agencies in one location, really indicating that they're not actually running an office or providing any care, or a hospice that's running out of a burrito shop, or all of these like terrible stories, some of which McKnight's has reported on. But the opportunity that has given is to have a more holistic conversation about hospice reform. So not only looking at the bad parts, like how do we deal with the fraud, and make reforms in the program integrity space to make sure that program integrity is appropriately targeted and getting at those bad actor hospices and not members like those of LeadingAge. But what other reforms can we make in the hospice space? And some of those that we're particularly excited about include expansion of respite care to include respite at home in the hospice benefit, as well as a more expansive inpatient respite opportunity for those that are transitioning between non-hospice and hospice services while families and caregivers get ready to bring them home, offering more inpatient options while that transition is occurring, as well as potentially paying for high-cost palliative therapies that have a palliative effect on the person who is hospice eligible, but have generally been too expensive for hospices to cover. So there's an opportunity to put more money, to move money within the benefit to pay for those services. So Representative Earl Blumenauer of Oregon has proposed this massive reform bill, the Hospice Care Act, and those proposals that LeadingAge had been pushing for are included, along with a number of program integrity reforms, including a temporary national moratorium on new hospices while we get this fraud situation under control, and then giving CMS some other tools to better target fraudulent behavior. So I think Mr. Blumenauer is retiring at the end of the year, so we're going to need a new champion to sort of pick up that effort and keep adding evolutions to the bill to make sure that it's in a good place for our members, and then potentially move that forward in the future. But we see that as like a 2025 effort.
Okay.
Yeah.
What do you think about Vice President Kamala Harris's home care proposal, and what do you think it signals about future thinking related to care at home and related to long-term care financing?
Generally, I think it's really exciting. We don't see a lot of long-term care discussion in presidential policy platforms. So her announcing that she wants to pay for home care services in Medicare, just to distinguish, we do have the Medicare home health benefit that already exists for skilled care at home. This proposal would add the payment for aid services, so assistant with activities of daily living, to the Medicare benefit, which is not currently covered as a standalone benefit and has been a major gap in care over time. So generally, we're really excited. We have a lot of questions about what the details would look like how would it interact with the Medicare home health benefit? How would it interact with Medicaid, personal care, and other services? But it could be exciting across our continuum of care. Obviously, members that already deliver care in the home are very excited, because it would be a way for them to get paid to serve a market that currently doesn't have coverage for those services. So they're very excited by that potential opportunity, and it could move it, it could be helpful in the assisted living space, for example, because you can get Medicare home health services in assisted living. So maybe there's a way to stack these aid services. Once again, the question of those coordination of benefits, if they're duly eligible, will come into play for sure. But generally, really excited about the potential. She's taking it seriously because she proposed a way to offset the costs. Regardless of whether that's the actual offset that's ultimately used, it shows that she's really thinking about doing this in a way that to try to make it happen, not in a bubble, not in a vacuum. So we're really, if she were to win, we would be really excited to work with the administration and the Congress, because this would have to go through Congress, on how to make that proposal into a reality that our members and those who serve could utilize. Actually, yesterday also, President Trump at a rally in Madison Square Garden announced his proposal for a family caregiver tax credit. So he has also, and there is language in the Republican National Convention platform about the need to support care at home for seniors as well. So regardless of which party ultimately takes the election, the amount that the boldness of the proposals vary a little bit, but there is this attention to the aging population, to seniors, and the need to support caregivers and older adults as they age in place.
So we'll see how the election turns out, and that may affect some of the things we're talking about today.
Yeah.
Now, McKnight's, as you know, has a home care brand, as I mentioned, and some other providers represented by LeadingAge are home care providers, as we've been discussing. But there also are community-based providers, such as adult day services providers. To the people working in senior living and care watching this interview, what do you think they should be thinking about their role in the aging services ecosystem?
Yeah, as we talked about when we talked about assisted living, adult day is another example of how the community part of care, of home and community-based services or home and community-based care, don't always get the spotlight that they need. So in terms of people wanting to age in place, services like Adult Day, which is a community-based setting where people can go for a number of hours per day, some number of days per week, to get respite services for their caregiver, assistance with activities of daily living, socialization. There's two models, there's social adult day and medical adult day. And in the medical, you're also getting supervision from a nurse, medication management, some of those services as well. And once again, it's a way to help people age in their home, age in the community, but gives them those community aspects and support for their caregivers that allow them to actually do that for longer. And it's just not a service that has gotten a lot of attention. It was really devastated by the pandemic because the way that their payment works, if you don't show up, if the person isn't coming, you're not getting paid. So a lot of them had to close. There is starting to be some that are coming back and some new ones opening, but it's a setting that's well deserving of more attention and could really be braided in with expanded access to home care. Because if you think about whether it's the vice president's proposal or just existing Medicaid coverage, you could imagine a world in which there's some home care coverage in the morning to help people get ready. There's transportation available to the adult day center. They spend some time there, and then they come home, and maybe they're getting some support on the back end from home care once they're home, depending on their level of need. But you can really see how they could all work together. But it's important, especially given the workforce crisis, like not every single person who needs some assistance is going to be able to get all their hours done in the home. So having this community option to complement home care would make that aging in place, aging in community all the more viable.
Well, switching back to hospice, in addition to the Hospice Care Act, what do you think are the most impactful regulatory and policy issues ahead for hospice and home health providers?
So starting with hospice, the HOPE tool, which is the first assessment tool that's ever been in hospice. In the home health space, we have OASIS, and in the skilled nursing space, we have MDS. Hospice has never had an assessment tool, and the first assessment tool was finalized in the final rule this year in August. At the conference this week, we're having a whole day devoted to thinking about that HOPE tool and the implementation and what hospice providers need to know about it. So that's like a new wave of the future in hospice is looking at the assessment tool and how that's going to be thought about by CMS for other changes in the future. So that is a big one. There's also a forthcoming hospice special focus program, which is akin to the special focus facility program in nursing homes, though it is the hospices that are chosen to participate in that program are done via a algorithm, whereas the nursing home program is completely done based on survey. So we've had a lot of concerns with that algorithm, and we are hoping to see a delay in the start of that program, which is supposed to start this year, so that we can continue work with CMS to ensure that they're targeting the right programs. Because I think because of a combination of the items chosen for the algorithm, which were not consistent with the technical expert panel that advised CMS during the development of the program, and with all this fraudulent activity sort of messing up the baseline of who's low quality, because the goal of the program was to help low quality providers improve. But now we have all these people who are committing actual fraud, sort of messing up that bottom tier and messing up the data. So until those things are sort of smoothed out, both like actually getting the fraudsters and like targeting them with fraud resources and making sure that making sure the inputs into the algorithm are correct, it would be better just to delay the program to make sure that we get it right, because we do have concerns that some programs will be targeted that really shouldn't be on the list. And if they are, and a beneficiary says, well, I shouldn't choose this hospice that's in this special focus program, I should choose a different hospice, they might actually end up with worse care. So we're concerned about that. And then on the home health side, we're very concerned about the forthcoming payment cuts that will probably be finalized in the next week or two. There have been devastating fee-for-service cuts in home health over the past 3 years that are making that industry, you and others have reported on closures in home health agencies, especially among nonprofits or consolidation. We're concerned that will continue to happen if these payment cuts continue. So we continue advocacy to reverse those payment cuts. And those are coming this year at the same time as they're starting the home health value-based purchasing program. The people are getting their final annual performance reports to see whether they're getting an increase in payment, no change or a decrease under the value-based purchasing program. And unfortunately, a lot of our members are looking at a decrease. Private nonprofits are the only ones that are getting decreases. And it has to do with the kind of patients that they take and the resources needed to keep up with such an administratively burdensome value-based purchasing program. So we do have concerns about the future of home health and how these different payment pieces fit together. And the third piece of that three-legged payment stool is Medicare Advantage, which woefully underpays home health and also just puts these huge administrative burdens on the providers through the prior authorization process. We're hopeful to get some movement on that, both from CMS, who has been doing some rulemaking in that space, as well as hopefully from Congress. They released an explosive report a couple weeks ago about the use of prior authorization in post-acute care. So we're hoping that will have an impact on the landscape.
Mm-hmm. So what do you see as the big issues affecting the entire continuum of long-term care, all the areas that LeadingAge represents?
Yeah, workforce. So the ability to, we all know the numbers that the aging population is growing. The oldest of the old, as they're, called, the 85 plus population is growing fast now, because some of those people who turn 65 are now going to turn 85. So having the workforce that we need to take care of older adults in whichever setting, we've talked about a lot of settings today, and whatever setting that they choose and that is appropriate to them, all of those settings need staff. And so do these potential very exciting expansions, whether it's a home care expansion into Medicare or additional respite options in hospice or more people electing to get Medicare home health. All of that needs more staff. Assisted living needs more staff. So creating the training pipelines that we need, both domestic and international, is critically important. Another piece is financing. We have options in the Medicaid program for people who are very poor, and we have options for people who have the resources to pay privately for what they need. There's not a lot in the middle. That is something that makes the VP's proposal exciting, is the idea that it would be something would be available to everyone regardless of their means. none of that has happened yet. So right now we have this middle market that is not served well by our aging services continuum, and our members are trying to innovate and find different ways, creating affordable assisted living, for example, by braiding together, Medicaid funding and HUD funding, right? Like our members are very innovative in how they think about how to serve those populations, but we really need more. So those are, and then finally, housing generally. We need affordable, accessible housing for home and community services to exist in. Whether that's independent housing for people to live in or affordable assisted living, we need ways for people, if they want to remain in community, they have to have a a home to remain in. And that's something that LeadingAge is unique in that we are able to talk about both sides, the healthcare side and the housing side.
Well, thanks for your time and for sharing those insights,
Yeah.
Mollie. This is Lois Bowers, editor of McKnight's Senior Living, and I've been speaking with Mollie Gurian, Vice President of Policy and Government Affairs at LeadingAge. Be sure to visit the websites of McKnight's Senior Living, McKnight's Long-Term Care, and McKnight's Home Care to watch other videos that we are recording as well with industry thought leaders discussing important topics. You'll find those videos under the Resources tab on the homepage. Thanks for watching.